There's a multi-million-dollar effort underway to bring more African-American doctors into hospitals and examination rooms nationwide. That effort is focused on easing the burden of medical school costs for students at historically Black institutions. In tonight's Eye on America, CBS's Jericka Duncan shows us how more Black doctors can lead to a healthier country.
You are doing amazing.
40-year-old Dontel Johnson dreamed of becoming a doctor as a child.
Did you see any Black doctors? Did you know any Black doctors?
I had never seen a Black doctor growing up. And one of the crazier things is I never saw a Black doctor until I hit college.
Johnson decided to apply to medical schools in Texas. But when a friend told him about a potential school in Nashville, Tennessee, full of Black students, he was in shock.
I told him he was a liar. I said this place didn't exist. I went home that night.
What did he tell you that you really thought it didn't exist?
He started describing a place of people that looked like me, that were dentists, doctors, scientists. So I went home that night. It was still, I had dial-up internet, so I had to wait for it to pop up. And then these photo stills came across of Meharry, and I applied that night at maybe like 1 or 2 a.m.
Johnson graduated from Meharry Medical College. He decided to stay in the community and is now a pediatrician and a professor there.
I think one of the things that's really coming to light, that patient population of African Americans and how systemic racism, how history, how the healthcare profession overall has not always been there for this patient population.
A population that has better overall health outcomes when treated by Black doctors, according to recent studies. To further those connections, this past August, former New York City Mayor Michael Bloomberg announced a $600 million gift to all 4 HBCU medical schools. Combined, they have educated roughly 50% of all Black doctors in the United States. Currently, African Americans make up about 14% of the population, but represent a little more than 5% of doctors.
Having a healthcare professional is important in the community, but also having a Black healthcare professional raises all the boats.
Dr. Valerie Montgomery Rice is president of Morehouse School of Medicine in Atlanta.
How does that uplift everyone?
First of all, it's going to allow us to educate and train more Black and brown physicians, and it's going to allow those students to have more choice in where they want to practice and to be less burdened with debt.
And that's something she's already seen. In 2020, Bloomberg gifted Morehouse School of Medicine $26 million to help students pay down debt. Resident physician Jamil Joyner received $100,000.
It not only says we believe in Black doctors, it says we believe in Black institutions and how they will play a role in changing healthcare for Black individuals.
For Dr. Dontel Johnson, more investment in Black doctors is needed.
I'm a living witness of that, of training up African American physicians that cater and care for the underserved. So when you look at the data together and say that, hey, when we partner with African American physicians and we put them in communities, we actually see less strokes, we see less hypertension in the community, we see less obesity.
Healthier communities, a healthier nation. For Eye on America, Jericka Duncan, Nashville, Tennessee.